Hi, this is Mike Adams, the Health Ranger, with a special report for InfoWars Nightly News. There's been a lot of breaking news now about Big Pharma. Runaway criminality and fraud has now gone on the public record involving 3 different companies, 2 of which are involved in lawsuits. In fact, we're going to talk about tonight GlaxoSmithKline. We're going to talk about Merck and its vaccines, and also Pfizer. These are 3 of the largest pharmaceutical companies in the world, and they now find themselves steeped in controversy, fraud, criminality, and lawsuits. We'll start with GlaxoSmithKline. This company just pleaded guilty to criminal behavior and is now paying a $3 billion fine. That's to cover both criminal and civil penalties to the United States government. And according to documents that surfaced in this investigation, which was a 9-year investigation by the U.S. government, GlaxoSmithKline engaged in all the following behavior. They routinely bribed doctors with luxury vacations and paid speaking gigs. They fabricated drug safety data and lied to the FDA. They defrauded Medicare and Medicaid out of billions of dollars. They deceived regulators about the effectiveness of their drugs. They engaged in off-label marketing, which is illegal. And they relied on these deceptive practices to earn literally billions of dollars selling potentially dangerous drugs to unsuspecting consumers. And all this time, by the way, doctors went along with it. So doctors were bribed. They were sent on exotic vacations to Hawaii and other locations like the Bahamas. And they accepted the money, and they continued to prescribe the drugs as long as they were getting paid. Some doctors were sent on very high-paying speaking gigs where they say, oh, here's $500,000, go on a speaking tour. It doesn't even matter if there aren't any people listening to you on the speaking tour. Here's just $500,000 to just go speak. And by the way, on the side, keep prescribing our drugs too. That's the way it works in the pharmaceutical industry. Now we have proof of that. It has come out, and the company, GlaxoSmithKline, is on the record committing criminal felony crimes. Now, you may ask, well, how come nobody at GlaxoSmithKline is being arrested for this? Why aren't the CEOs being marched and having a perp walk, so to speak, in handcuffs out the building with all the media looking on? The answer is the U.S. government doesn't care about the runaway criminality of the pharmaceutical industry. They literally do not care. Government doesn't want to know about any crimes in Big Pharma. They don't want to investigate. They don't really want to do anything. They were forced into this settlement by whistleblowers who came out. There was just so much evidence they couldn't ignore it. That's the only reason it came to this $3 billion settlement. But in other cases, and now we're going to talk about Merck, the Department of Justice says, we don't want to know about it. We don't want to investigate. We want to just allow the scam to keep going. And this involves 2 virologists, former employees of Merck, which has a monopoly on the manufacture of the mumps vaccine in the United States. Merck has been granted a monopoly over the mumps vaccine by the U.S. Food and Drug Administration, the FDA. This monopoly has existed since 1967, but it is dependent on Merck being able to demonstrate a 95% effectiveness rate for its mumps vaccine, which is part of the infamous MMR vaccine that many people believe is tied to autism and neurological disorders. So in order to create this 95% efficacy rate, according to the 2 virologists of Merck who went public with a False Claims Act filed in 2010, Merck actually fabricated its test results. And these virologists say they witnessed it firsthand. Merck fabricated it and then designed a second test, and they spiked it with animal antibodies. Yeah, the complete scientific fraud, medical fraud, according to these virologists, and then presented that information to the FDA to say, hey, it's 95% effective. See, look at the antibodies in the formula, even though it was spiked with animal antibodies. Again, complete quackery and fraud being alleged by these 2 virologists. Merck then went on to threaten those virologists with being thrown in jail if they went public with it, according to their complaint. And Merck lied to regulators and defrauded the U.S. government, according to them, of hundreds of millions of dollars through Medicare and Medicaid fraud, selling a vaccine that was nowhere near 95% effective. Now, a couple of interesting points in all of this. Number one is that all of those people who actually got vaccinated with the mumps vaccine over the last at least 10 years You may have been completely hoodwinked and fooled by it. You may have been a victim of quackery and fraud, but you can't sue. You know why? Because the government grants the drug companies total immunity for all damages related to vaccines. So they can sell a fraudulent vaccine that could even harm people and damage people, and those people who are victims of the fraud have no due process remaining to them. They can't go to court. They can't have their day in court. They can't even get a refund on a product, even if it was fraudulently sold. Now, also, there's the issue of Obamacare. Obamacare forces people to effectively do business with criminal organizations like these drug companies. So Obamacare grants a monopoly to the pharmaceutical industry over your medical needs and your healthcare needs. Pharmaceuticals, biologics, and vaccines, of course, chemotherapy agents, other things that are used in medicine. So through Obamacare, you are now forced to do business with an industry that is just deeply infested with criminal behavior and outright medical quackery and fraud. Keep that in mind as Obamacare continues to kick in between now and the year 2016, where you're going to have to pay a fine to the IRS. You're going to be penalized because it's a new tax that's going to go to the insurance companies, and that money then goes to the drug companies that are engaged in exactly the type of fraud and criminality that we are describing here today. How's that for a system of medicine? You can't even call it socialized medicine. It should just be called fraud medicine, junk medicine, quackery medicine. A complete mafia medicine might be a better term for it. But the situation with Merck gets even more interesting. It's not just these two virologists that came out and talked about it. It's also that the company is being sued by a healthcare provider named Chatham. And details of that lawsuit will be presented here in just a second. But first, check out this interview we did earlier today with John Rappaport, who has comments about the Merck faked vaccine situation. Check it out. The Chatham Primary Care has filed a lawsuit against Merck now, claiming that they were defrauded by Merck because of a, quote, decade-long scheme to falsify and misrepresent the true efficacy of its vaccine. It says that Merck knows and has taken affirmative steps to conceal that this mumps vaccine is far less than 95% effective, and that this has been going on since at least 1999. Wow, this is a long-standing, ongoing situation. So are you familiar with the details of that lawsuit, John, or do you have any comments on it?
Well, the comment that I have is I'm happy to hear this, because since the Department of Justice will do absolutely nothing to prosecute the people at Merck responsible for this, then if you can pile on with more lawsuits, that's a good thing. If you can get different groups who were actually defrauded, just like this one was, to take them to court and say, well, we were defrauded too, so pay us out as well. Because what this is saying basically, Mike, is if a drug company defrauds intentionally 100 million people, those 100 million people deserve something in return.
Yes, at least a refund. If not,
at least a refund,
if not
yeah.
more punitive damages.
Quite a bit more, because they were injected with something. It wasn't like you bought a toaster and it didn't toast the bread, you know.
It did probably toast their brain a little bit, though.
Right. So, yeah, you would deserve
stealth
a little
viruses.
bit more.
Well, yeah, but see, this is the big picture here, is that there's immunity granted to the drug companies over vaccines. So you can't have a class action lawsuit now. So the government has created a situation where there is no justice for the fraud that's now emerging from the vaccine industry. There is no justice.
Well, that's what they did. That's how they covered themselves. The vaccine companies went to the government 10 years ago, a little bit more, and said, well, guys, basically, we're going to get out of the vaccine business because there's too many lawsuits and we can't make any money. And so there were meetings. They sat down in a room and they started to hammer out this whole kind of agreement. And the government said, well, you know, I mean, we got to keep making vaccines. I mean, come on. And the drug companies were kind of laughing up their sleeve. And they said, well, look, if you grant us immunity from lawsuits and you create some kind of hokey little government payout system with a lot of red tape, then we can make a deal. And the government said, yeah, sure, why not? We can do that. And that's what happened. And that's why you've got this very limited window of opportunity to make these drug companies pay for what they do.
All right, that was John Rappaport with information about Merck. Now continuing with the lawsuit against Merck, which has also come out. Here's some of the verbiage that's in that lawsuit. It alleges, this is from Chatham Primary Care, it alleges that Merck engaged in a decade-long scheme to falsify and misrepresent the true efficacy of its vaccine. That it fraudulently represented and continues to falsely represent in its labeling that the mumps vaccine has an efficacy rate of 95% or higher. And that Merck knows and has taken steps to conceal that its mumps vaccine has, since at least 1999, been far less than 95% effective. And here's the big one. Here's the big one. That Merck also continued to conceal what it knew about the diminished efficacy of its mumps vaccine even after significant mumps outbreaks in 2006 and 2009. So between this lawsuit and the two virologists who went public with their False Claims Act, they allege that Merck actually contributed to the outbreaks of mumps that were witnessed across the United States over the last several years. In other words, the very company that manufactures a vaccine that claims to be stopping the pandemic of infectious disease, mumps in this case, is in fact the very company that is causing the spread of disease. That's a pretty clever scam, quite a ploy, if you will, to sell more vaccines. You cause the outbreak, then there's a scare about the outbreak. The CDC jumps on board and says, hurry up, everybody go get vaccinated to stop the mumps, and they blame the non-vaccinated children for causing the outbreak, and that results in more parents taking their kids to be vaccinated, which then results in more profits to the drug companies for selling the very vaccines that are based entirely on fraud to begin with. Imagine that happening in America today. But that's not the end of it. There's one more company that's relevant to this discussion here on InfoWars Nightly News, and it's Pfizer. Pfizer is now being sued by many of the top retailers, pharmacy retailers in the United States, including H-E-B pharmacies in Texas, by the way. And they claim that Pfizer is engaged in an anti-trade conspiracy of sorts to prevent generics from coming onto the market that would compete with Pfizer's sales of Lipitor. It's hugely profitable cholesterol drug, which sells about $9.6 billion worth of drugs in a given year. Yeah, really, almost $10 billion worth of drugs. No wonder they're trying to keep competitors off the market, according to this lawsuit. So if you put all this together, you've got GlaxoSmithKline now admitting to felony crimes. You've got Merck, whose own whistleblowing scientists say the mumps vaccine has been based on fraud for at least 10 years, maybe much longer, that it doesn't work and that it actually contributes to the spread of infectious disease in America. And then you've got Pfizer being accused of anti-competitive, monopolistic, price-fixing, anti-trade practices that's trying to, according to the allegations, prevent generic drugs from competing with its blockbuster Lipitor drug. You put it all together, what do you get? You get an industry of complete medical fraud. It's a hoax. Much of modern medicine today is a hoax, and in fact, instead of helping you, many of those medicines and vaccines just harm you. But they convince you to buy them, and they convince states to enact mandates that force people to take these vaccines. We've got one more segment for you here from another guest, Sean Nimai, who we spoke to today. He's a former U.S. Army medic. He had an experience about how the vaccines are being forced on U.S. soldiers in the military, active duty in Afghanistan in his case. Turns out that an experimental vaccine for the H5N1 hoax pandemic was given to the military with instructions to have it injected into all the soldiers. But this gentleman, Sean Nimai, he said, well, he was in charge of over 100 soldiers over there as a medic, and he said, I don't want to give it to my soldiers, and I don't want to take it myself. And they threatened to have him fragged for it. Yeah, threatened to have him thrown in a locker with a live hand grenade because he questioned the sanity of injecting yourself and your men with an experimental vaccine based on a completely false pandemic with the sole purpose of enriching the profits of the very drug companies that are scamming Americans every single day right now in 2012. That is what's happening in America today. So check out this segment from Sean Nimai.
In 2009, I was in Afghanistan, stationed there for a year deployment with the 10th Mountain Division. I refused to receive or give the H1N1 experimental vaccine at that time. It was received at the time with a little bit of distrust from my chain of command. But once I explained to them that it was an experimental version, I didn't feel safe giving it to soldiers when I didn't even have a pamphlet that normally comes with medications and immunizations. We had no literature
Really?
at all.
So they just
Correct.
said, here it is, take it, and we're not going to provide any information about it. Just trust us, basically. Is that what they said?
It was generic labels on the bottles. All it said was keep refrigerated, and this is the dosage.
Wow.
That's what we were told about it.
So what caused you to have red flags about it? Why would you even suspect the safety of it in the first place?
Well, part of the biggest reason that I questioned it to begin with was the fact that there was no literature. I'm kind of OCD about making sure that I read all the literature to all the medications that I'm supposed to give to my soldiers. When there was no literature brought with the vaccines, I requested from the Brigade Medical Services Office, hey, you guys forgot to send the literature with this. And they said, no, there isn't any. Just follow the directions on the labels that are on the bottles, and you'll be fine. So at that point, I decided that it was time to look a little deeper into things. Found out that there was actually 3 different batches, 3 different formulas of the H1N1 vaccines that were being mass-produced for human use. 2 of them were being distributed to civilians all over the world. The 3rd one was being distributed to U.S. military members only. That also raised a couple of red flags.
Yeah, the special soldier edition with no documentation. So let me ask you this. How many soldiers were you in charge of in terms of their medical care?
I don't remember the exact number. It was a little over 100 of the U.S. soldiers from my unit and a couple other units that were co-located with us, and then approximately 250 Afghan national forces that we did different missions in conjunction with them.
Okay, and where did you receive your medical training, and can you describe it just briefly so everybody has a background of your medical background, so to speak?
Yeah. After basic training at Fort Leonard Wood, Missouri, I went to AIT's Advanced Individual Training, which is medic school at Fort Sam Houston in San Antonio, Texas. Spent, I think it was about 4.5 to 5 months there, learning not only an EMT civilian side of emergency medicine, but also the Army side of tactical combat casualty care, which is a little more, I don't know what the exact word would be. It's a little more goal oriented in keeping people alive, not so much keeping them pretty.
Well, keeping them alive is a good thing, but then, so it sounds like with the vaccines, you were concerned about the implications of that experimental vaccine on the health of the people whose health you were, at least in part, responsible for. So when did you start getting resistance to this, and how did that emerge in your experience there? What happened to you? Because I saw at one point you were being threatened with even being fragged.
Part of the preparation for the next upcoming deployment was we would have to go and have our medical records screened, get whatever immunization, shots, eye tests, dental screenings that's needed in order to go overseas. At that point, I decided, well, I'd already decided up until that point that I wasn't going to receive any more of the immunizations and vaccines. I talked with my wife, and we were in agreement that because of our religious convictions, that it wasn't right for us anymore for me to be receiving these. That at that point, I put in what's called a religious exemption request to basically get me an exemption from any and all vaccines, immunizations, prophylactic medications such as the malaria pills.
Yes.
I'm sorry?
I said yes, and now that's a normal accepted procedure in the military. So why wasn't that accepted in the chain of command? What happened there?
Well, part of the problem is that sort of an exemption is only approval denial up until company level commander. It doesn't have to go any higher than him. And my company level commander in a cavalry unit, it's called a troop. I don't think he liked me very much.
I have an affidavit here. I'm sorry, your voice cut out.
That's okay. I was just saying that there had been a history between him and myself during different training exercises and such. And I really don't think he liked me very much. So he had already made up his mind before he had looked into the regulations and whether or not I was even allowed to request such a thing. I'm pretty sure he already made up his mind that he was going to deny it and give me an order to go get shots.
So it sounds like this was a punitive, vengeful type of action targeted to you personally because of personal disagreements. Is that a fair characterization?
I would definitely say so, yes.
And then I have an affidavit here, sworn affidavit by a Sergeant Medic Team Leader, Anthony Comau, who supports your story and says that this captain began to refer to you as, quote, bacteria man, and said they want to throw you inside a wall locker and throw a hand grenade in with you.
Correct.
So that's a pretty serious accusation and a serious crime in the military, if true, indeed.
Yes. Even the act of stating anything about fratricide is actually a crime. It's against the Uniform Code of Military Justice.
All right, so there you have it. That's a wrap of the situation. We live in an extraordinary time of incredible deception from the big pharmaceutical companies and the vaccine manufacturers. The bottom line in all of this is those of us who were skeptical of the vaccines, we have been vindicated. So if you've been saying no to vaccines, if you've been trying to educate people or even perhaps argue with your ignorant doctor about vaccines, you were right all along. Vaccines are fraud, drug companies are criminals, and they're engaged in anti-competitive, monopolistic trade practices to simply bilk consumers for as much profit as they can get away with. And to a large extent, the U.S. government, now infected with rampant, deep criminality, is letting them get away with it. You're not going to get this report on any mainstream news source, but it is the truth, and it is backed up by evidence. Thank you for joining us here on InfoWars Nightly News. This is Mike Adams, the Health Ranger, with a special report for InfoWars Nightly News. Take care.